We've been so quietly saving lives for 53 years now that most people don't even know that it's here, and we're here to support anyone in crisis.
It's amazing how many people in the greater Reno area or even in the state of Nevada that don't realize that we have a 24/7, 365 suicide and crisis prevention hotline right here in Reno, Nevada.
We're not just a suicide hotline. We're not even just a crisis hotline. We literally will talk to people from anything from a long-time addiction issue to yesterday's breakup with your boyfriend.
Every single person experiences some sort of crisis, and each one is as important as the next.
So many of our callers will say, "Is this confidential?" And of course it is. And it's almost like they can't believe it sometimes. They'll say, "Yes, we're not telling anybody this."
SAS, I had no idea until I got involved here, are who provide the advocates for anybody who's been raped.
When we're talking about someone who has just been sexually assaulted, a word that we use a lot in our SAS program is trauma brain. So they can't remember all of the details in order, but they are trying to convey that something has happened to them that they did not want. It was unwanted. So they're trying to figure out what their next move is going to be.
A lot of times there's such stigma and victim blaming around sexual assault. And the guilt, for whatever reason, that the victim feels is just devastating.
We do see elders come through our SAS program, and it's just a reminder that sexual abuse is a problem from childhood up until a lifetime.
They're an incredibly vulnerable population because of health issues and disabilities that come on with aging.
You know, somebody who's calling a crisis hotline is already not in a good place, and then drugs get into the mix, and all of a sudden you don't think it can get any worse, and then it does.
A lot of the thoughts about suicide are because of the use of alcohol and drugs. And unfortunately, Nevada has a high rate of drug use, and we get an awful lot of those calls.
What most people don't realize is that one person's suicide impacts about 100 other people, in their friends, their family, everyone who knows that person.
I take a very accepting and understanding view of suicide, that this isn't somebody who's crazy or, I don't know, a jerk. It's somebody who they need help and they don't see any other way out of it.
I understand what these people are going through, and in that moment of kind of fight or flight, having a crisis moment, having someone to reach out to can make a significant difference, not in just the moment, but the rest of their lives.
We are more than just a suicide prevention hotline. We are continuing to add more programs within the city of Reno and in the rural areas.
When you have a community advocate on your side, they're connected to all of the resources in the community that they may need. A lot of the time, if we see someone that has a substance abuse problem and we look back in their history, you can see that there may be a history of sexual assault in their background. Because people have substance abuse problems, sometimes those situations can make them more vulnerable to become sexual assault victims during their addiction period.
It's hard to get help for substance abuse, especially if, unfortunately, you've lost your insurance because you lost your job and your family's disowned you because you've kind of got yourself in this hole. So I'll talk to people who I want help, but I can't get it. I don't know where to get it.
Elder abuse to me is pretty tragic because it doesn't get as much attention as child abuse. No, we don't want children to get abused, but elders are people too, and just because they're nearing the end of their life doesn't mean that they don't deserve the same respect and care that they did as younger adults or as children.
The idea that CSSN can help people who are going through that can't use their own voice is a big deal.
By taking the reports, we're bringing attention to something that otherwise would get ignored. When you are in a situation where you feel like there is no other way out, your brain is just casting for any kind of solution. Can I do this? Can I do that? Well, you know, I wouldn't be in this much pain if I was dead.
I don't want to complete suicide necessarily because it's what they want to do for themselves. They truly feel like they're a burden to family, friends, coworkers, the world. And as you remind them that they are in no way a burden, you know, and I even use myself, like, I'm involved in your life now, so if you do something, it's going to affect me, it's going to make me sad. So there you go. You've got at least one person that cares about you.
A lot of times, people just need a safe place to talk.
I can't imagine what our community would do if this organization didn't exist.
The more people know about this organization, I think the more they will want to help and volunteer.
I'm the first one to spread the word that we are here for other people to call in, and I just wish I could get more volunteers.
Anytime you can be involved with this organization, that's going to save another life.